Hafaday. Good afternoon. We're on air now. We'll start. Thank you. Hafaday. Good afternoon again. The Committee on Health and Human Services, Health Insurance Reform, Economic Development, and Senior Citizens reconvenes this public hearing. The time now is 2:36 p.m. and the only item on the agenda this afternoon is Resolution 316-32, which is relative to expressing the concern of I Liheslaturan Guahan relative to the applicability of the Patient Protection and Affordable Care Act to Guam and requesting equitable reconsideration of its applicability to Guam by the President of the United States of America, members of the United States House of Representatives, the U.S. Senate, Secretary, U.S. Department of Health and Human Services. And I'd like to thank Vice Speaker Cruz for being here as well this afternoon and joining me, and also being one of the main co-sponsors of this resolution. What this document really is it compiles all the arguments that our island, our territory, has been sending to the federal government since the passage of PACA, which is also known as Obamacare. And there are certain provisions that have already kicked in and have been in place here in our island, and there's also a lot of challenges that we face. And so what this does here is send our official expressions, send our concerns to the U.S. government in terms of what needs to be done. Their actions are needed in order for us to move forward here. And so I'd like to thank, of course, the stakeholders, insurance companies, people from our government, the insurance commissioner, and also all other stakeholders who have been with us in different roundtables we've had in putting this together and laying out our story and laying out our concerns and how important it is for the federal government to hear us. I need to also recognize others in the national level. We have Alaskan Senator Lisa Murkowski, who had written to the U.S. Secretary of Health and Human Services as well, stating her concerns as well as how the territories are being treated. And so, we're reaching out to her. We're reaching out to anyone we could that can help us articulate our concerns to the federal government. I want to share with you that I was at AFLAC had this event about 2 weeks ago, and they had a representative from their national group there. And so when I shared how our challenges are and our experiences in implementing certain provisions of PACA, they were very shocked, number one, and number two, very interested to see how they can help as well in getting our message across. So they have a political action committee set up, and so we're going to use them. We're going to use every avenue we could to get our voices heard. So if we need to stand on that highest mountain we have here on Guam and shout, we're going to do that. And so we're going to work as well with our congresswoman to ensure that this resolution, once and if it is passed by this body, is provided to the appropriate individuals. Okay. I'd like to call on Sir John Carlos, who's representing the Insurance Commissioner. If you could join us. Also, Mr. Frank Campillo. And anyone else who wishes to provide testimony, I invite you to come up here.
Good afternoon, Mr. Chairperson. Good afternoon, Vice Speaker Cruz. The Insurance Commissioner, namely my boss, Commissioner Artilagan, is in favor of this resolution. The resolution states in insurance companies are required to provide to observe the market provisions on the Public Health Service Act. Some of these provisions, for example, guaranteed issuance of policy to individuals and to small shop owners, guaranteed renewability. If you have a health insurance policy, it's guaranteed that you can renew it. And it's also guaranteed starting in 2015 that if you buy a health insurance policy, you will have the essential health benefit plans. These are not existing before in our health insurance plans. So this will have a tendency to increase the amount of the claims, and without the individual mandate, employer mandate, and the subsidy, the insurance companies will have a hard time trying to balance out the interest of the policyholders and the interest of the company. So those are the challenges facing us. So, this resolution lays out those problems, to the national government, and we, as one island with one voice, will probably be sending one message by this resolution that there should be more provisions of the Affordable Care Act that should be made applicable to Guam, particularly in terms of individual mandate, employer mandate, and subsidy. We have submitted our written comment by way of email, and we ask that the legislature take those into consideration. Thank you very much, sir.
Thank you very much, Mr. Carlos. And yes, we did receive your suggestions, and we'll ensure that we include that, the final cut version. Mr. Campillo?
Thank you. Good afternoon, Senators. I echo the statements that were made by Mr. John Carlos, and all I ask is that we move this resolution as quickly as possible. There is a meeting in DC of the agencies, what is called the interagency meeting at the end of the month, and I think it would be very, very important that they get a hold of this document. I understand they got 2 hours specifically set aside for healthcare, so if we're able to get this document ahead of time, it will be very helpful.
Absolutely. Thank you very much. And Frank, I want to thank you. In the last roundtable hearing, we've asked, we finally asked, okay, what is it? We've been meeting, we know what the problems are now, what can we do? And, for your recommendation that perhaps this is one route to take, is send a united voice and by way of a resolution. So I want to thank you for that, and also thank you for the input you provided to my office on this. Great. Vice Speaker, do you have any comments? Nothing? We do have others in the audience who had signed up, not to testify, but just in favor of the resolution. If you change your mind and you'd like to say a few words and testify, I invite you to do so now. If not, yes, we have Melissa. Thank you.
I would just like
State
to
your name, please,
Yes,
just for the record.
It's Melissa Weibel from the Guam Surgery Center and Island Cancer Center. My testimony is essentially just that I commend the senator for putting this resolution together and sending it to our government in the United States. I think, unfortunately, oftentimes the territories, and Guam is obviously one of those, are forgotten whenever they're putting together programs and policy, but yet they include us in its efficacy, and it causes great problems and great distress for those territories. So I'm in huge favor of this moving forward, and I just wanted to commend those who worked on it, and thank you for that.
Great. Thank you very much. If there's no one else that wishes to testify, we would adjourn this public hearing, and we'll move it as fast as we could through the process to make sure that we get it in time for that meeting. Okay, great. Thank you very much. So that's 2:47, and this hearing is adjourned. Thank you.